Australia's pharmacy industry is a vital part of healthcare. But the critical funding model that supports it is in danger of becoming unbalanced. To understand the risks, we first need to understand the system. It starts with drug manufacturers who research and develop medicines. The federal government then determines what medicines should be made available on the Pharmaceutical Benefits Scheme and how much patients should pay for them. Doctors then prescribe the medicines to their patients, who go to their community pharmacist to get the prescription filled. Because pharmacists can only stock a relatively small number of medicines, Australia's pharmacy wholesalers act as a virtual storeroom for pharmacies, delivering around 1 million medicines daily to more than 5,400 pharmacies around the country, ensuring patients get the medicines they need the same or next day, enabling pharmacists to improve the health and well-being of millions of Australians. It's a robust system that really works. The way the government uses taxpayers' money to fund the system is equally robust. It involves the PBS, which lists how much manufacturers are entitled to receive for their medicines, and the Community Pharmacy Agreement, which determines how much funding there is for the pharmacists and pharmaceutical wholesalers, and includes the Community Service Obligation, which provides funding that underpins the safe and secure delivery of medicines to pharmacies anywhere in Australia, generally within 24 hours. The PBS and Community Pharmacy Agreement are interdependent because the size of the first is used to determine the level of funding for the second. So how much pharmacy and the wholesalers receive for their services is directly determined by how much the government spends on the PBS. Historically, the cost of medicines has been growing. That increase in the size of the overall pie has been critical in enabling pharmacy and wholesalers to keep pace with the ever-growing volumes and business costs of delivering medicines and health services, such as wages, rent, security, and transport. So, while the two parts of the pie have grown, the funding formula has worked, ensuring they've grown in sync. However, this crucial balance is under threat. As many more generics continue to enter the market, how much the government will pay for PBS medicines supplied by pharmacy might shrink by as much as $6 billion over the life of the next agreement. While this is good news for taxpayers, it's important to ensure that patients can still access the medicines they need. Because the price of medicines determines the funding that supports their delivery to patients, that means the whole pie will shrink. In other words, the current formula assumes that if medicines are getting cheaper, so must the cost of running the businesses that support their delivery to patients. Price cuts to the PBS have seen wholesalers having to cope with lower payments from government as the medicine prices have reduced and diminished returns, down to about 2 cents in the dollar. Wherever possible, the CSO wholesalers have reduced their costs and the fees they charge to minimise the impact of PBS reform on their pharmacy customers. And in an effort to bring even more efficiency into the supply chain, the CSO wholesalers have invested tens of millions in new technology and systems. However, the trends are alarming if the funding formulas in the agreement don't change. At the moment, around half the medicines have a PBS price to pharmacy of less than $15, and because of the 7% margin, a maximum fee to wholesalers of $1.12, and more often, much less. It's anticipated that by 2020, more than 80% of medicines will have a PBS price to pharmacy of less than $15, further limiting the amount wholesalers can charge, between $1.12 and just 5 cents for most medicines. In fact, if the formula remains the same, funding for wholesalers is forecast to shrink by $400 million over the life of the next agreement. This means the supply task facing the CSO wholesalers would increase by 200 million medicines over the life of the agreement, while the remuneration would drop by $400 million. It would be asking an already stretched supply chain to do more, but for much, much less. As spending on PBS medicines contracts, so does the funding needed to keep the rest of the supply chain viable. If the funding model isn't rebalanced, a range of things will change. The level of service that pharmacies can deliver will change. The most vulnerable pharmacies will be the first to be impacted as funding for wholesale service declines. In the end, pharmacies will have to fund the gap themselves, and many will simply find it too tough to survive. That's why the National Pharmaceutical Services Association, representing the CSO wholesalers, is advocating a balanced community pharmacy agreement that's based on the volume of medicines and delivers a fully funded CSO. We're working actively with the Pharmacy Guild to support them in their advocacy of community pharmacy, and we're backing them to get the right outcome, because it's what's needed to keep the whole system healthy.